Hello, everyone, and welcome back to Cloud Wars Live. This is the podcast where we dig into the digital revolution and the extraordinary changes taking place across business and in our personal lives, and if there's any space in between those two categories these days. We're delighted to have with us today from Workday, John Kravitz, who's Vice President and Head of Go-to-Market for Workday's healthcare business. John, good to see you.
Thank you, Bob. It's great to see you as well.
John, it seems over the last few years, every industry has gone through just some incredible changes, but I can't imagine that there's any industry that has undergone more changes than healthcare. And now you add into that these extraordinary new developments that are coming up with AI and ML. I'm just wondering, can you start off, give us an overview of how those powerful new technologies, how Workday is using those powerful new technologies to help your healthcare customers have better outcomes?
Certainly. As most folks are aware, Workday is an ERP solution, so we don't have specifically the electronic health record. However, we work very, very closely with the EHR vendors. But really, artificial intelligent machine learning helps fulfill the promise of patient-centered care by learning from the past patient records. Already, we have seen that AI and ML applied to help our diagnosis, to help with automation, to help guide our care recommendations, and so much more. And we're seeing the promise of generative AI, which will take all the dictation and notes and help summarize the diagnosis and, of course, cause to action. Patient care is a traditional function that's enabled by the EHR system, and we're all aware of that. However, we believe that the ERP system can also help fulfill a promise of patient-centered care. So an example of that is our patient-centered supply chain, something that we've worked on judiciously over the past 6 or 7 years, providing patient supplies required for surgical procedures in the acute care environment. With Workday Supply Chain Management, we see machine learning playing a role that is really important to get the right supplies that are available for the elective surgeries and patient-centered medical homes. There's just such a need for these supplies and to keep things moving on time and keep the trains in motion, so to speak. And so, we see the value of this. Our customers are also seeing the value and are really complimentary of the work that we've done. We have a way of bringing automation, to the future of our work by the use of generative AI. These tools make it easier to align skills employees have to the job requirements. So specifically in the human resource area, we find a lot of value, especially important for patient caregiver roles. It's also helpful when using Workday machine learning. The machine learning can really learn from the past to make recommendations for future work that will be transpiring. It's also analyzes skill gaps to make skill suggestions, recommend learning to develop new skills, and even optimize the workforce that is deployed. One of our impactful applications of machine learning is people analytics, which is connected very closely to our human capital management system. As analytics have become more and more prevalent, end users are swimming in data. They can see changes in trends and KPIs, but struggle to take action. That's where the stories engine from Workday comes into play. It runs through these large data sets and presents a story, especially an explanation of what is driving a certain KPI, and guides the end user to the root cause, simplifying the analysis and promoting action. So, for example, if I notice the RN turnover is increasing across the health system overall, people analytics will point me to the key drivers in a specific department or a specific category of nurses. So that can be RNs, nurse assistants, any of those areas that can draw our attention and focus. We have 60 million users of our systems across the world. This allows our machine learning algorithms to be fine-tuned to meet the needs of the person that's using our system. We don't want to take people out of the equation. We want to support the work that people do. We can personalize the experience for each user, ensuring they get in and find what they need, complete the task, and then return to patient care, which is extremely important. And this foundation of data allows Workday developers to apply machine learning to solve a variety of issues, both big and small.
Well, John, that it's fascinating to hear the range of applicability that you've got with these new technologies and the benefits the customers are having. And, I think the other side of what Workday over the last few years has been moving more and more toward industry solutions and industry capabilities. So clearly all those sort of touch points that you mentioned there are going to benefit from this. So could you talk a little bit more about how Workday is using industry specific capabilities to help drive better outcomes for hospitals, clinicians, researchers?
Yeah, so Workday has well over 10,000 customers that are using our systems daily in the cloud. Just for a point of reference, so that folks that are listening to this webinar, we have one version of our software, and we actually provide updates to that on a semi-annual basis. So every 6 months, traditionally March and September, we will provide major enhancements to that software for all industries. Healthcare is a relatively newer industry segment. And when I say newer, it's probably since 2016 that we've created the healthcare vertical to really focus on healthcare. And so now we've got well over 375 healthcare systems that are using it, but the same applies to other industries like the financial sector, banking, insurance, distribution, all manufacturing, all those other industries that are utilizing Workday. So it affords us the opportunity to enhance our system at a rapid pace with these 2 major releases per year. And Workday continues to evolve technically and functionally from year to year, allowing us to evolve and adapt to the healthcare industry changes, as well as other industry changes, Bob, that you're referencing. With these upgrades, we take a large percentage of the work and we create base changes to our system based upon what our customers are telling us. We have advisory boards, we have special interest groups, and we truly listen to what our customers' needs are and look to make changes to the core system to add new functionality, new capabilities that they're looking for in the base system. This allows us on a semi-annual basis to really start turning that flywheel sooner to provide much more enhanced functionality to our end users. We have some things too, like labor productivity analysis, how we could take our platform, work together with our customers regardless of industry, and partners to address specific cases such as rising labor costs, which really makes certain that we have the right staffing and the affordable staffing in place to meet the needs. In our case, healthcare, but certainly applicable to other industries as well from our human capital management system. We have the right product. In healthcare, clinical products are supported pathways. We have a workforce that reflects that community. So this platform is further innovated and optimized time and time again.
John, from your extensive professional history within the healthcare business, this hands-on, but it's not just the largest industry overall, but it's also healthcare seems to be one of the most complex and so many moving pieces, and there's regulatory issues and other things going on. So when Workday comes in and is dealing with some of these extremely complicated situations, how are you able to sort of extend what you do or help your customers extend the impact of that across this sort of vast and often complicated healthcare ecosystem and network?
Yeah, I would agree with that statement wholeheartedly, Bob. Having been a healthcare CIO for the past 30 plus years before coming over to Workday, we really have a proven track record of helping organizations across healthcare, providers, life sciences, health insurance, and even retail operations that are involved in healthcare. So oftentimes people think of healthcare and they're only thinking, an acute care hospital, maybe an ambulatory surgery center, but there are just so many other components of healthcare that we work in and we solution for our customers. Our focus in the healthcare industry, bringing expertise to this industry with our employees and our partners, mainly through addressing the talent shortage. That seems to be the biggest challenge that we're hearing since the pandemic, where people are struggling. Salaries have increased because of competition for people. People have changed careers. They've left healthcare, which is a real challenge. So healthcare organizations are struggling because of that. But organizations that have an HR process to bring people on quickly, and one of our customers cited a 25% increase in the ability to hire staff. These are really tangible results for us. Another example is the use of strategic sourcing for our supply chain. Everyone's hearing about the supply chain woes and the challenges of getting supplies. But what's really important with strategic sourcing for us is the ability to look across the continuum and find the best pricing, the inventory of solutions that are available for us that we're able to acquire the supplies that we need for the healthcare systems for our customers. Through the use of strategic sourcing, a very prominent West Coast health system saved $4.2 million in the first 6 months that they turned on strategic sourcing. They also cut 4 weeks out of their RFP process, which initially took 12 weeks to accomplish, and gained sourcing visibility across their hospitals. So those are things that really are a value add. It's not the black hole or the abyss any longer. We have the ability through use of our tools, our applications, and AI and ML to be able to dig in deep and find this information. There's another, I have a couple more examples I'd love to share with the group. We actually have an example where we have an academic medical center located in the Midwest. This academic medical center, leveraged Workday learning management system, connected right into the human capital management system. So the platform is invaluable to maintain compliance on a required annual learning for the staff and the medical group. Now, employees and medical staff have access to all the required learning in a single ERP platform. Although Workday Unified Enterprise Management System is the foundation of delivering these results, we fully embrace our partnerships and collaboration we have with our partners and our customers. For example, we've been able to grow our supply chain management solution, be one of the most widely used systems in the cloud, due to the strong partnerships we have with our customers, who help us shape and guide the development. We also work with our service partners to innovate on the best practice. Those use cases are so important for healthcare, and we look at ways that we can configure, not customize the system, so it's easier to move forward with future upgrades and enhancements in the platform, in the core.
Well, John, that's an amazing range of examples you cited there. And in the first one, where with the West Coast provider, right, not only saving them over $4 million, but also the time, right, that it, that quicker sense to action. So I imagine those are the sorts of things that, every healthcare organization is looking to achieve. And so if we look at this broader notion of healthcare transformation, all the different areas that you've described, are terribly relevant, and you see the impact there. But now you add in those, as if that's not complicated enough, you got cybersecurity issues and privacy issues and regulatory issues. So how does Workday's experience with, that vast range of customers, and particular some expertise in the healthcare field, how does that all roll together and help you drive, help these healthcare organizations not just do what they did a little better, but also move forward on the digital innovation path?
Yeah, that is a great point. And so many healthcare CIOs are looking at a path forward, right? When I was at my prior job at Geisinger Health System as a corporate CIO, one of the things that I was looking at, and I did this 3 years ago and had endorsement of our IT strategy committee, and that was to start going forward with cloud-based solutions only and not moving forward with on-premise solutions. Mm-hmm. And there were some reasons behind that decision. One of those, Bob, was the ability to scale, ability to leverage the use of the environment for high availability. Another was that high availability turns into continuity of services. If we had a disaster, that we can continue to work and not be down and impact the care being delivered to our patients. So for us, that was extremely important. From that point forward, and I've talked to a lot of CIOs since coming over to Workday, and they have a very similar strategy, but they're going further than that. They're looking at the cloud, and they're looking at it for a number of their data center applications, and have developed a strategy to leverage that. So now it comes to the question that you asked, which I think is really, really important, and that's, regulatory issues, privacy, cybersecurity. How does a cloud, provider make certain that we take all that into account, protect the data, for our customers, so that they can sleep at night and not worry about data being breached, not worry about someone getting in and stealing data or copying data or anything like that. So these are all important factors, but The way that we do it at Workday is we have a true enterprise management cloud for healthcare. And it's the same cloud for all systems, all environments, and all industries. But the Workday platform is built on an intelligent data core that takes security, privacy, compliance, organizational hierarchy, and analytics and business processes into account as the foundation for the dynamic platform. So if you think about that intelligent data core, that's where all the data resides. But layer on top of that specific applications like human capital management, finance, supply chain, enterprise planning, reporting. They're all built on a higher layer. And the difference from Workday to some other companies that moved to the cloud is we didn't have an application that was developed for your data center and then migrate that to the cloud. Ours was built in 2005, and the idea behind it was to start moving to the cloud. 18 years ago, we decided we're going to build it in the cloud. So all the intelligent data core and the frameworks were all built in with the cloud in mind from day one. So I think that's an important factor. And healthcare organizations really have appreciated that. We also, have the ability outside of that to help organizations accomplish this goal with Prism Analytics, to be able to provide a lot more information that's discernible and actionable for the healthcare system. We have one example, and I don't want to use their name specifically, but it's a large health system that has a large presence in the Midwest as well as the East Coast. They use Prism Analytics a lot. They want to build a 360-degree view of the headcount of the organization, the turnover that they have, attrition over merged companies. They want to improve safety and prevent costs from incidents by comparing safety and worker by location, so they can look at their data and dissect that data. They join time data to track, hours worked, overtime, mandatory hours worked. And finally, they surface employee engagement scores directly on a management dashboard. That's something that we as an organization really believe in employee engagement. And we actually do our scoring weekly to be able to track where we go. Now that seems a little excessive for most healthcare systems. Where I worked before, there was an annual survey and then a touch point middle of the year survey. But you have opportunities to do that and leverage that data accordingly. So we also work closely with our partners to provide innovative solutions to solve customer business problems, not by customization, but by configuration. And again, as I stated before, Bob, we don't customize our product offering. And this allows us on those biannual upgrades and enhancements that take effect, which there are plentiful changes to the system, again, based upon customer requests for these enhancements, the ability to continuously innovate the application suite without a cumbersome process of retrofitting code customizations back into the platform.
Right.
I myself, 30 plus years in healthcare, that's always been a nightmare and a pain in everyone's backside. But with this opportunity to do it this way, this approach, it's fresh, and it really, really works, where an upgrade happens quicker. People test it, they get involved, they make sure everything's working properly and turn it into production quickly. And our partners bring industry expertise and best practices to solve complex customer problems. With the newest offering, we have an industry accelerator for healthcare. We're working with a couple of our partners, and we really want to work with Workday and those corporate industry leaders to have best practices in technology innovation to assist all of our customers, have a expedited and successful referenceable customer go live experience. And then finally, one of the key challenges healthcare providers face is keeping the product and price information accurate and up to date. So we've worked with our global partner, one of our partners, it's Global Healthcare Exchange, or GHX, for the supply chain to keep accurate data when it's needed by our customers. So an example of that is when we have one customer adds a new item to a item master file, they have the option to search a virtual item master in the GHX Data Connect system, and they add clean data back to their system with product and price information directly into the item master file in Workday. And this item is continuously kept up to date automatically in the background. clean up the data product and price data, and we help keep compliance with significant cost savings and reducing errors across our supply chain.
Well, John, this has been a fascinating conversation, and I just wanted to ask you as we wrap up here, it's going to be, I would think, comforting for your customers in the healthcare field to speak to somebody who has been through the wars that they've been through, as you have, right?
Yes.
So you represent, functional expertise and experience, but also, able to discuss these very modern solutions that Workday has. That's got to feel good to somebody on the other side of the table.
It's amazing, Bob, how many CIOs that I know through either Chime or other organizations, and you make a lot of friends over the years, which is always important and helpful. But they ask a lot of questions, and we are always take the high road. We're always truthful. We share everything that we can do. We won't promise things that are in development. We'll make certain that we only talk about things that are really available now, and then we'll have a roadmap that we could share with either a customer or a potential customer for a timeline when these things would be available if they're looking for it. So we're excited about that. And CIOs are genuinely excited. I just attended the Vive conference, and I could tell you I spoke to a lot of CIOs. They knew I came over to Workday, and they're really curious, and they're really intrigued and interested in Workday, which I'm ecstatic about. I don't have to push it or sell it. I just talk about it from a CIO's perspective, which for me is phenomenal. So
yeah. That's the best way forward, it sounds like, John. That's great. Well, John, thank you so much. Really enjoyed the conversation with you here.
My pleasure, Bob. It's nice meeting you. Thank you so much.
You're welcome, John. And folks, to all of you who are with us, thank you for being with us here on this special edition of Cloud Wars Live, brought to you by Workday. And we've been speaking with John Kravitz, Vice President at Workday and head of their healthcare go-to-market business. We'll see you next time.